better watch out. You better not cry. You better not pout. I'm telling you why. Santa Claus is coming to town. Oh, he's making a list and he's checking it twice. He's gonna find out who's naughty or nice. Santa Claus is coming to town. Oh, he sees you when you're sleeping. He knows when you're awake. He knows if you've been bad or good, so be good for goodness sake. Oh, you better watch out. You better not cry. You better not pout. I'm telling you why. Santa Claus, he is coming to town.
Very good morning, good afternoon, and good evening to one and all. Homeopathysoftware welcomes everybody around the globe for the third International Lucky Dip. And today we will have, a lucky winner. Let's see who gets the free Zomeo today. Our agenda for today is very simple. We're definitely going to tell you what offers we've got. We've got a fantastic session planned for you by Dr. Vijay Vaishnav today, all the way from the United States. Stay tuned for that session, which will start in about 10 or 12 minutes from now. And he will also announce who the third Lucky Dip winner for this afternoon or evening is. All right. And my dear friends, just to reiterate of what this Lucky Dip is all about, it's very simple. Let me just explain this offer to you. We've got a 40% off this Christmas season on all our products on Zomeo, on Zomeo Ultimate, and all our premium courses as well. A minimum purchase of $250 and you enter the Lucky Dip contest. I'll just share the dates with you. This is the third one that we have. We started on the 15th and it goes to the 5th, 12th, 19th. And on the 31st, we've got a mega Lucky Dip of 3 winners to be announced. We've had the first winner was an Aussie from Australia, Dr. Sushil Gupta. Last week, we had Dr. Mandeep Kaur, winner as well from the United States. And let's see who it is this week. And we've got a contest, a carol singing contest going on. So Christmas is a season of love, peace, care, joy, and happiness. So what do we have? It's very simple. Sing a Christmas carol, upload it on your social media account, tag us and at Homepath Social on Instagram and Facebook. If you're not on social media, just write to us. Very simple. Sing that carol, write to us, and you can win lots and lots of prizes with us. Okay. So my dear friends, before we start today's session, that's the webinar that we've got by Dr. Vijay Vaishnav. Like the last time, we had a lot of fun. We had some, we had lots of spot prizes to be won. So today as well, you can win yourself some mobile applications from Homepath Softwares. You could also win yourselves some webinars, some simple questions to be answered, and why not? Okay, like the last time, the first three individuals Dr. Vesna Marinkovic, congratulations to you. Before I announce the first spot prize, you're already a winner because I'd announced it in the last Lucky Dip. All those who keep their videos on will get a prize. Which country are you from, Dr. Vesna?
Serbia.
I beg your pardon? Did you say?
Serbia.
From Serbia. Fantastic. That's nice.
Thank you.
Okay, so the next two individuals to keep their videos on get a spot prize from us. You can get some exciting webinars. Come on, let's see who it is. The next two. We've got one winner. Let's see who the next one is. It's very simple. You just keep your video on. That's it. And there you go. You get a prize. Come on. It's okay. Now, Mr. Indranil, we need to see you. We need to see you. We don't need a screensaver. Yeah. One. She might get both the spot prizes. Okay, one more. Let me go on to the next segment of what we've planned today. I can still see a few more joining in, getting some technical glitch. Okay, we'll have a small a questionnaire here. Okay, you'll have to type your answers in the chat option. Just make sure you have the chat directed to everybody in the meeting. Okay, I'll ask you some questions pertaining to Christmas. If you do get the right answer, well, there are some gifts to be given to you by Dr. Jawahar Shah. Okay, so eyes down and ears open for your first question. Your first question is, you'll have to name as many objects that you can think of pertaining to Christmas with the letter that I give you. I will give you one letter from A to Z, and in the chat option, you'll write it all together. Okay, so the first letter that I give you is the letter R. R as in Roger. R as in Roger. Anything that you can think of pertaining R to Christmas, write it in the chat box, and let us see if you get it right. Come on, try for at least two. Okay. Oh, you're directing it to me directly. Okay. Come on, Dr. Ahmed, Dr. Ansari, Dr. Nilima, and Dr. Vesna.
I'm not good understand. Yeah, sorry.
With the letter R, anything that you can think of. Or let me simplify this for you. Name any 5 things that you can think of pertaining to Christmas. Whatever comes to your mind. There are so many hints in my image. I'm wearing something. There's something at the back right here. There are objects on something that's there at the back. So come on, write it in the chat box. Please type here in the chat box. Come on. Let me see. Okay, I've got a couple of answers that's directed. Yes, Christmas tree. That's right. Any others that we've got? What you can think of? Dr. Amit, I'm waiting for some answers from you. All the way from Canada. Okay. Happiness for all people in the world. Yeah, that's true. So happiness is a broader concept. I'm sure in happiness you'll have 1,000 more things included in it. Dr. Ansari, Dr. Nilima. Okay. Kindly keep your chats to everyone while posting. Yes, keep it open to everyone. You're writing it individually to me. So Dr. Vesna Marinkovic has won 2 prizes yet. So that's amazing. Wow, that's good. Okay. So friends, let us now move on to something that's really important. And without further ado, let me introduce to you someone who's really special. I'll give you a small introduction about him on the slide, Amay. And Dr. Vijay Vaishnav, he has been practicing for more than 37 years. So an MD, certified classical homeopath, CCH, USA, and a former professor and head of the Department of Materia Medica at the CMP Homeopathic College in Mumbai, India. Dr. Vijay Vaishnav has, like I just said before, over 37 years of experience. That's staunch experience in clinical practice as well as teaching internationally. He has been closely associated in developing new concepts in teaching Materia Medica and has prepared a unique model of approach to the study of homeopathic therapeutics. I move on to my next slide. And okay, he has been a faculty for the practitioner and the doctoral program in homeopathy at the American Medical College of Homeopathy at Phoenix, Arizona, a grand rounds teacher at the National College of Naturopathic Medicine, Portland, a visiting faculty at the Caduceus Institute of Classical Homeopathy, Santa Cruz, California. He is also a subject matter expert for the Central Council of Research in Homeopathy, Government of India, to review and to contribute to many of its publications. He is currently practicing homeopathy in California and is on the board of the California Homeopathic Medical Society. And most important out of all of these is he is present with us live today, and he is going to give us a wonderful session. So without further ado, I'll hand it over to Dr. Vijay Vaishnav. Over to you, sir. Thank you.
So as Gordon just introduced me, I'm Vijay Vaishnav. I have been a student of homeopathy for over 41 years, and I still continue to be a student of homeopathy. And today I'm going to share with you what I learned as a student and what you people could also learn from other doctors and other homeopaths and use that in your practice. So I'm going to talk about things that I saw maybe 40 years back that influenced my prescriptions, how other doctors and senior doctors whom I was working under, how they treated cases and how that helped me treat difficult cases in my practice. So let's start with I would like to call today's session as Homeopathy Musings. So it's just a reflection on some of the cases that I have seen treated by others. You must always learn from other people's great responses, and you must also learn from your own mistakes. So today I'm going to talk mainly about how I used other people's experiences in my practice. So I was working as a registrar in our hospital, at the homeopathic hospital. We had a 100-bedded hospital in Mumbai, which is a teaching hospital. And I was a lecturer as well as a registrar in the Department of Medicine. So I was handling lots of different cases in the hospital, in the outpatient as well as the inpatient department. And there was one case that really struck us because we had just freshly passed out of the college. And there was this patient who was brought, a girl, I think she was around 10 years old. She was in a leading conventional allopathic hospital in Mumbai. It's a very famous hospital called the Breach Candy Hospital. And she was unconscious. She had been in bed for almost 2 months. The doctors there gave up and said, we've done everything possible. We've given her all the possible treatment. She doesn't seem to improve. So looks like you might have to just take her home because your bills are just going up and we don't think we can offer much. Now, she was sent, or she was actually brought from that hospital to our hospital. And our principal at that time, Dr. Anil Bhatia, he was a person with a lot of clinical acumen. He took the case. This was a case of tubercular meningitis. She had tuberculosis of the brain, and the base of the brain had been affected, and the patient had been unconscious for 2 months. This case was the first case I saw where it looked like there's nothing we can do. But Dr. Bhatia said, there's a lot we can do for her. And he gave her a remedy called iodoform. Iodoform is a remedy that should be used in the treatment of tubercular meningitis, very clearly mentioned here, and for all sorts of tuberculous conditions. So this is a girl who came with basal meningitis. She had most of her faculties were not really there. She was unconscious. She had pupils which are dilated. Sometimes they were dilated, sometimes they were contracted. Now, dilated pupils, our first remedy of choice in an unconscious patient is opium. But our principal said, look at the pathology. We are dealing with tuberculosis. We are dealing with the brain being affected because of tuberculosis. It's not because of a stroke or a hemorrhage in the brain that has caused the coma or the unconscious state. So on the basis of just the diagnosis of tubercular meningitis, he prescribed iodoform to this child. We were surprised that about a month later, this girl went back home walking, all because of homeopathy. And that left a deep impression on me and all the other doctors who were working there. We saw this person with a very bad pathological state. From an unconscious state, she sat up and she started walking. Now, this is flashback. This was, I suppose, in 1986 or 87 that this is what I had witnessed. A few years later, I was teaching at the Homeopathic College. I was handling the outpatient department. We used to see on an average around 40-45 patients in those 2 hours in the outpatient department. And this boy was brought to us. He came straight from the railway station, from his village. He came to Mumbai, and from the railway station, he came with all his bags. His family brought him to our outpatient department with a history of conversions. He had conversions that used to come at any time of the day, and they came with the CT scans. The CT scan showed a tuberculoma. As you can see, there's this lesion in the frontal cortex. He had a tuberculous granuloma that had formed. So the TB had gone to his brain, and that was a source of irritation, and he was getting a lot of conversions all the time. So we admitted him. We took his vitals, we monitored him, and going back to this case that I had seen so many years ago, where iodoform had helped, I gave this child iodoform in the 30 potency. He was not on any tubercular treatment. He was not on the regular anticox treatment, and he just came for homeopathy. So this is before the treatment. This is a close-up of the CT scan, which shows the lesion, the granuloma. We treated him for almost around 4 or 5 months. So initially he was an inpatient. We discharged him, and he's to visit us once every 2 or 3 weeks to our outpatient clinic, and we would observe his response. His seizures came down. He used to get 2 or 3 seizures a day, and then there was a time when in 3 weeks he would get 1 or 2 seizures. At the end of around 4 or 5 months, his seizures stopped completely. And we decided after 6 months to repeat his CT scan. And as you can see, the lesion has almost completely regressed. You can just see a small spot of calcification that is there in this patient's brain. Here's a close-up. Just a small spot of calcification. As you know, tuberculosis usually heals by calcification. If you have a lung lesion, you might find calcified spots in the lung. So this is what happened to the patient. He cleared completely. His symptoms went away. Just the symptoms going away does not mean that you have cured the patient. The pathology also has to go. And this CT scan done about 5 or 6 months after his treatment was started with iodoform 30, tubercular meningioma. Following that, I have had quite a few other cases of tubercular meningiomas where this remedy iodoform was used to help take care of the patient's infection. And you find that it works wonders. So this is a remedy that you must keep in mind when a person has tuberculosis involving the brain. Now, if we go back to the previous slide of iodoform, you find that this remedy represents quite a, or it is similar to quite a few other homeopathic remedies. For example, sleep interrupted by sighing and cries, and the patient is very drowsy. Apis mellifica is a drug for encephalitis, a person who has an inflammation of the brain, and you find that they have sleep which is interrupted by sharp, piercing cries. So this is another drug that you might think of sometimes. You would think maybe this person needs APIS because a patient has sighing and he's crying, or there are sharp, piercing screams. But remember the difference in the pathology. One is a global encephalitis, while here it is basically a localized tubercular lesion. Drowsy state. When a patient is very drowsy, our first remedy we think of is gelsemium. We think of another remedy that we could think of is opium. Now, gelsemium and opium are two remedies that you have to consider when a person has a central nervous system disorder, when they're going into a state from a drowsy to a comatose state. If a patient is drowsy with respiratory symptoms, you would think of antimonium tartaricum. Antim-tart becomes extremely drowsy when they are going into respiratory failure, mainly because now there is something called hypercapnia. So I'm talking pathology because when you're dealing with other doctors outside the homeopathic system of medicine, you have to impress upon them how homeopathy works and what it does and how it helps to reverse some of the complaints. So also I'm trying to make you realize that whenever you see a patient, at the back of your mind, you are also doing a differential diagnosis of the remedies. You start looking at the remedy relationship. You try to rule out, without getting prejudiced towards one particular drug, you try to rule out different remedies to see that you come to the correct conclusion as to your prescription. So antimonium tartaricum, for example, will have a person will be extremely drowsy. They have a cough, which is a rattling cough, and they become drowsy. They become very irritable. Now, this is mainly an indication of hypercapnia or carbon dioxide intoxication. Because the lungs are not functioning, the amount of carbon dioxide in the blood starts rising. As it crosses the blood-brain barrier and the amount of carbon dioxide content in the blood increases to the point where the brain now is affected, you will find that they become drowsy because of the carbon dioxide intoxication, and they become irritable and they become peevish. So that peevish, irritable person in antim tartaricum, when it's related with the respiratory system, it's mainly because they have hypercapnia and the blood-brain barrier has been crossed and the amount of concentration of carbon dioxide in the blood has gone alarmingly high. So the important thing is remedies can be very similar to each other. You have to be able to differentiate. And for that, you need to keep reading. So you need to keep reading your homeopathic Materia Medica. Every time you read a remedy, try to see how it is similar and different from other remedies that have similar symptoms. That's the only way you can actually expand your knowledge of homeopathy and be a much better prescriber. So this is one case that I had seen when I was a fresh graduate from college, and that helped me get the confidence to treat and to show the results of homeopathy to my students when I was a professor in the college. There was another case that we had seen again in the hospital. This was an emergency. Once again, our principal, Dr. Bhatia, was the one who was handling this patient. This patient came with a sudden pain in the abdomen. And this person started vomiting. When we saw him in the outpatient department, I was, of course, working at that time under Dr. Bhatia. So it was not my own clinic, but I was working as a registrar there. He had all the symptoms of peritonitis. The peritoneum seemed to have been inflamed. And he had pain, he had sensitivity at the abdomen, and the whole abdominal wall had become very rigid. We could not even palpate, we couldn't even press hard. Dr. Bhatia felt that this looks like, with the history of peptic ulcer that he had in the past, this could be a ruptured peptic ulcer. So the peptic ulcer had actually gone and made an opening in the stomach, and that has caused the acid and the food contents to leak out into the peritoneum. So we've got an X-ray of the abdomen with this person in a standing position, and sure enough, it showed air under both the domes of the diaphragm. So the air had also leaked out from the abdominal intestinal contents into the abdomen. Now, most people would consider this as a case that requires surgery. But Dr. Bhatia said, I think we can treat this person with homeopathy. We don't need to send him for surgery. We had a full-fledged surgical unit in our hospital. So I called up the surgeon who was in charge for that day and let him know that we have admitted a patient who has a perforated peptic ulcer, but we are planning to give him only homeopathic treatment. And we would like you to be on standby in case the patient's condition worsens. We would like you to come in and take over and help in managing the case. The patient was kept nil by mouth because we didn't want any food or water to go in and irritate the peritoneum further because of this hole in the stomach. And the only symptom that the patient gave was, I feel really full. My stomach is so full. It feels bloated, it feels distended. If only I could pass some gas, if only I could burp, or if I could pass some gas from below, I might feel better. So on the basis of this symptom, Dr. Bhatia gave him a drug called Refanus. Refanus is basically the radish, and it's known for its gastrointestinal symptoms. And if you look at the stomach symptoms and the abdomen symptoms, the abdomen is tympanic. It's hard. No flatus emitted upward or downward. Griping about the navel. And there's a pad-like swelling of the intestines. There's also a vomiting of fecal matter. So these are all symptoms of intestinal obstruction. And in this person, he had basically a peritonitis, and the whole intestinal activity had stopped because of this inflammation that was going on within the abdominal cavity. So on the basis of this very important keynote that the patient came up with, he prescribed Refanus in the 200 potency. The patient was kept nil by mouth for 2 days. By the end of the day, his symptoms subsided. He did not feel the distension. He had no pain. He actually, next day morning, he also passed a motion. And 3 days later, we repeated the X-ray of this patient in the standing position, and it showed that the air that had leaked out had already been absorbed, and he was on the road to recovery. So most likely, a small amount of the mesentery covered up that opening on the stomach and patched it up. And that was all as a result of the use of Refanus. So this was a surgical case that he was willing to take up, and he said, let's try homeopathy. We have the doctor, the surgeon on standby who can always come in and help, but let's first see how we can help with homeopathy. This is flashback. This is again, maybe 1987, 88. Coming back to the future, a few years later, a young boy, he was appearing for his HSC examination. He came to my private clinic in Santa Cruz in Mumbai with a lot of pain in the chest and the neck, and he had difficulty in breathing. Now, because of the fact that I was teaching medicine to our students, the first thing I did was inspect and then palpate, and I found that there was a lot of crepitation. You touch the skin on the neck and on the chest, and it was crackling. There was a lot of air that had escaped under the skin, and everywhere you touch, there was a crackling feeling. So it looked like there was a ruptured lung, and air had escaped from the lung and entered into the mediastinum. So we sent him immediately for an X-ray, and the radiologist actually sent back a note to me saying, I agree with your diagnosis that this person has a subcutaneous emphysema. most likely because of a ruptured emphysematous bulla. So there was a bullous, the patient was a case of asthma and he had emphysema. The lung had become so weak that one of the alveoli opened up and air leaked out and entered into the mediastinum, and then it spread into the neck region. It went on the chest wall. I had him admitted under me in the homeopathic hospital. Once again, I called up the ENT surgeon who was there on that day and let him know that we've admitted a case. He might need tracheostomy if the air keeps filling up and compresses his lungs. He might need a tracheostomy and we might need to have you come and intervene. But in the meantime, I'm going to give him homeopathy. And these are, of course, pictures. These are the positives of the X-rays. So it helps to highlight the fact that there was air over here, air under the diaphragm, in the skin, under the neck. This patient had difficulty in movement. The slightest movement caused a lot of pain in the chest. He became extremely thirsty. And on the basis of the acute totality, bryonia was given to him. I think this was on, so the date is covered up by the screen, but this is 1989, just a few years into my practice. So I was still a very junior homeopath, but having seen other homeopaths take up cases successfully, it gave me the strength to also try and treat this patient. Now, as you can see, these are subsequent pictures. I think the first was on, I think either the 14th or the 17th of February. Then on the 20th, we repeated the X-ray. And then the 24th, you find all the air has been absorbed. All this white part is gone and it's completely absorbed. So in about a week's time, he was completely free of all the air that had leaked out into the mediastinal cavity. So bryonia was a remedy that was given to him as an acute prescription. He developed some amount of thrombophlebitis because we had kept him on IV fluids for some time. We didn't allow him to eat anything in case he needed surgery as a backup. And one of the veins got inflamed because of the needle that was there in his vein. So instead of giving him some of the locally available allopathic ointments, we decided that we will give him hemamelis. Hemamelis was used as an external application on the vein instead of giving him any of the other allopathic external applications like thromboform that they use normally. We gave hemamelis external and it helped heal the inflammation and the thrombophlebitis in the vein. So basically, again, what I had seen my seniors prescribe gave me the strength and the courage to help treat someone else who came with a real emergency. So what is the takeaway from this? The takeaway from this is have faith in yourself. Make sure that you do a lot of reading. Make sure that you are clinically very sound. Try to get as much knowledge as possible from all other avenues that you can, like attending seminars, for example, sitting with senior homeopaths, learning from them, trying to get as much of clinical knowledge as possible. Because if you are good clinically and if you have good homeopathy knowledge, you will find that you will have a lot of faith in your ability. Have faith in homeopathy is another takeaway. At the same time, don't be foolish and take up all cases that are outside the purview of medical line of treatment. When you know that you can treat and when you know the pathology is something that is treatable, go ahead. Also, make sure you have people who are willing to be backup for you. Like the surgeons in our case, we had told them and informed them that we might need their help, but we would first like to try homeopathy. So the takeaway is keep working hard. Even right now, after 42 years of homeopathic study, I still keep reading every day. Sometimes the boring, sometimes the repertory are my bedtime stories. I sit down and read, and then while I'm falling asleep, the book is still in my hand, because that's the only way you can update yourself. And every time you read any of these books, you will find there's a new symptom that you've never seen before, even though you might have read that particular drug 20 times. The 21st time you might find a new symptom that becomes very significant, because maybe you're seeing a case at that time which had that symptom, or you, over those few years, you had another case and you learned something which you are now able to use in your practice. So that's basically a very short homeopathic musing. The aim was to let everyone know that it is not difficult to practice homeopathy. It's easy to practice. There are no rare remedies in homeopathy. Remedies are only rare because you have not read them or you don't know them. But none of the remedies, neither iodoform, nor raphanus, nor eel serum, are rare remedies for me. They are used by me in practice, just like I use Calicarb or Natromune or Sepia. So no remedy is rare in homeopathy. It is rare only because you are not aware of it. And the more you read, the more you practice, you study, you will find that your knowledge will go up and your prescriptions will be much better.
Thank you, Dr. Vijay Vaishnav. This was genuinely a very knowledgeable session, and I'm sure once we send across to most of our database, they're really going to be enlightened with this. So, Dr. Vijay Vaishnav, if you can do the honors and announce the winner. Okay, here we go. 3, 2, 1. Spin the wheel. Third lucky dip. And your winner is Dr. Vijay. You'll have to announce this.
So it's Stamata Sideris from Australia.
All right, there you go. Congratulations, Dr. Stamata Sideris.
Congrats.
So thank you so much, Dr. Vijay Vaishnav. We've got a second Aussie in the last 14 days to win a prize. Wow, amazing. That's good. She's just won herself Zomeo software with more than 40 repertories, Materia Medica's patient management. So for everybody, if you ever need a demo or any training, we've got doctors available with us. We've got one of them, Dr. Sneha Goyal, also, who's part of our team, and who can always offer a demo to you, or any training that you need post you've bought the software. So we also offer these facilities to you. So there you go. This was the third lucky dip, my dear friends. And just to reiterate, you can have a look at the dates, the next lucky dip, of what date it is. We've planned many. So these are the dates, and I'll explain the offer, how to enter the lucky dip. Very simple, 40% off on Zomeo and on Zomeo Ultimate and our premium courses. Minimum purchase, $250, and you automatically enter this contest. If you've got the Zomeo software and you still want to participate in this lucky dip, you can upgrade it to the ultimate version. We can also upgrade you. You still enter the contest if you upgrade it from Zomeo to Zomeo Ultimate, which has Segal Expert System, Scholten Expert System, and the Tempra's Expert Systems. All right. Everybody, a very happy and a prosperous new year from Team Homepath and from Dr. Jawahar Shah. Thank you very much.